We are extremely fortunate to be joined by Dr. Diane Stockton, who is a consultant in public health and the COVID-19 Social and System Recovery Lead for Public Health Scotland. And she's here to talk about how we mitigate the risk and harm to young people of COVID-19 and what YouthWork's role is in this. I'm sure as you can imagine, this is an extremely busy time for Diane and her team, so we are very grateful that she is able to join us. Diane, welcome.
Thank you. Thanks, Lorna. And I'm delighted to be here. Thanks so much for inviting me along to talk to you. It's great to be here. And I'm going to tell you a bit about the balancing act we have at the moment around mitigating the risk and harm to young people from COVID-19. And that's tension that we've got between managing the spread of the virus and managing the harms to young people that we get through the restrictions that we have to put in place to manage that spread. You know, this is a dilemma that we all face together. It's not something that anyone alone is facing. And I'm really interested to be here and the role of youth work in promoting and supporting public health around this. So thank you very much. As Lorna said, I'm the COVID Social and System Recovery Lead in Public Health Scotland. One of my key areas of work is around education. So trying to keep our schools, colleges and universities safe and open. And I'm also involved in looking at the wider impacts, the wider harms that the pandemic is causing, and trying to kind of mitigate those as much as possible. And for my sins, I also a little bit involved in the COVID-19 vaccination. So if anyone's got any questions on that, I can always try and answer those at the end too. We all seem to have about 10 jobs at the moment. So there we go. Just to say, the next slide, please. Just to say very briefly, in case of some of you haven't heard of Public Health Scotland, it's new. So we were 2 years in the planning, but we actually went live on the 1st of April this year, which was terrible timing, just after the pandemic hit us. So it's been an interesting 9 months for the organisation as we set ourselves up at the same time as dealing with this. So it brings together all the kind of 3 national agencies that were around data intelligence, health protection and health improvement. And we've got kind of 4 key priorities that we're trying to address. So one is obviously the impact of COVID-19, the impact on health, economy, society. Secondly is around health, life expectancy. So we've already got poor life expectancy in Scotland, and it's not really improved. It hadn't improved for the 9 years or so before we had the pandemic, and it certainly won't have been helped by that. And also health inequalities, they're wide in Scotland, and they've worsened over the last 10 years. So, for example, quite a worrying statistic around health inequalities is that the impact that health inequalities have on how people live in Scotland. You could have 6 COVID pandemics in the next 10 years before you've come anywhere near the kind of impact of inequalities in Scotland. So they're the kind of really big challenges that we face, and that Public Health Scotland is trying to address. Next slide, please. So the 3 aspects of the pandemic and around public health. So one is the direct impact of the virus, I'm going to tell you a bit about. One is the unintended consequences on the wider determinants, which I'm also going to talk about in relation to young people. There's also the impact on health and social care, and everything you'll hear in the media about people not attending hospital, but I'm not going to talk about that today because that doesn't have the same impact on young people. Next slide, please. And the next slide, if we could talk first of all about the direct impact. So I thought you'd be interested first of all to understand what's going on around our young people in Scotland. So these figures are, this is number of cases that have been diagnosed with COVID-19 in our young people in October. So a 4-week period, most of October. So each week in kind of our 12 to 17-year-old age band, we get about 300 cases of COVID diagnosed. And in our 18, 19-year-olds, we get about 500 cases. The older age group was largely driven by the universities returning and halls of residence and a spread of COVID in that age group. Some of the 16 and 17-year-old numbers have been driven also by that. The numbers, you'll be pleased to know, are beginning to reduce in these age groups. In the 16, 17-year-olds, you might have heard quite a lot in the press just in the last few days around face masks, for example, in schools in older children now. So that's partly driven by those numbers there. It's more a precautionary measure because there's not any really strong evidence in Scotland of older children transmitting within schools. It's more out of school transmission of the virus, but that precaution that has just been put in place. Next slide, please. Just to put what's happening with our young people into context, this shows over time how many cases we've got of COVID in Scotland. And the bars at the bottom, the purple ones are kind of younger children up to age 15. And then we've kind of got yellow bars, which are the older, are kind of 18, 19, 20 to 24-year-olds. So you can see that puts into context how many cases we're getting, around 9,000 cases. You'll see this was a week ago, and you'll see mainly in working age that the numbers have been increasing over time and are fairly stable. The numbers have been increasing a bit, but they're fairly stable in the younger age groups and in our youth populations. It's the older age groups that are increasing. You'll be also in the last week, the numbers look like they're stabilising more generally in Scotland. So it's a bit early to tell yet, but we're hoping that increase that we've been seeing is hopefully what's been put in place around the mitigation measures is hopefully having an impact. Next slide, please. This graph is a bit tricky, but I just wanted to show it to you. So the red shows hotspots. This again is over time and by age. And I just wanted to point out to you the bars, the 18 to 19-year-old line. So you can see the numbers really did increase quite a lot into September, and they started to come down. So around 700 and nearly 800 children were being diagnosed a week towards the end of September, and this is right now come right down to around 230. So that's the impact of the universities, and the numbers have also started to come down in some of the other kind of younger age groups. So we are seeing a shift in what we're seeing, and it's now the older age groups where we're seeing the increases in the COVID transmission. Next slide, please. And just as well, just to point out that we're not seeing a lot of children and young people who end up being hospitalised with COVID. Thankfully, we've had no children or young people who died from COVID in Scotland, and the numbers that are being hospitalised are very low. So in terms of how many young people go to hospital every week, it's less than 1% that are going to hospital because of COVID, and none of them have had any serious complications. So that's a bit of scene setting around that. Just next slide, please. I also wanted to tell you a bit about the impact on people that work with young people. So we haven't got information on youth workers and COVID. We can't specifically identify that, but what we can do is identify people who have, when they've been to the test and trace system, and because they're a positive case, that have said that they work in an occupation sector, which is early learning and childcare, or education and childcare. So that this probably would, depending on what your job is, you might classify yourself as that when you're asked what your employment sector is. But the last column just shows over time what proportion of all positive cases are people that say they work in education and childcare. So it's been consistent. It's been around 5% since schools went back. So since kind of late August, it's been that very last column. If you look at that, going down around 4 to 5% of people consistently over time are saying that that's where they work. So there's not been an increase. So with you know, with schools being back longer, with the universities being back, people that are working, there's not been an increasing proportion. There's been an increasing number because there's been generally been an increasing number in the population, but it doesn't seem to be specifically linked to working with young people and young adults. Next slide, please. And finally, just on the kind of direct COVID harms as well, I just wanted to also show you this graphic, which is around all school children up to age 17, and how many of them are off school, have been off school with due to COVID. So the very top black line shows the total number of children that are off school at any one time, due to any kind of COVID related reason. So it's almost 20,000 at any one time. It's quite a big number, but most of those are off because they're self-isolating in relation to COVID rather than having COVID themselves. So that the lines along the bottom, the lighter blue lines are actually the children that are off due to COVID, having COVID symptoms or diagnosed COVID themselves, and the much higher blue line that you can see on the graph there are the wider children. And what we're doing at the moment is quite a lot of work to see whether we really do need to have as many of our children off school, if we need to be isolating as many children when it's a case, because we're being quite cautious at the moment, and we've now got enough information. We've been back at school for long enough that we can interrogate that information to see how many of children that were self-isolating actually went on to get COVID themselves, so that we can maybe change that a bit, because of course that's a worry, and it'll be a worry for you as youth workers around the amount of young children that are at home, especially if it's repeats of them being at home. Next slide, please. Moving on to the unintended consequences of COVID-19 on young people. Next slide. So we do know a fair bit about how young people have fared during the pandemic from various surveys. So there are a number of surveys, they're listed here. Now, there is a bit of caution that we have to attach when we look at these surveys, because they were all conducted online. We don't know how much bias there is in terms of how the children that could access, the young people that could access the surveys, and how representative they are of all young people. But they do give us valuable information about how young people fared specifically during the lockdown. You'll have much richer information from actually talking to young people, but this is what the surveys are saying. Next slide, please. Thank you. So in terms of physical health, so this is how much physical activity children are getting, how physically active they feel they're being. So younger children, kind of under 13, didn't really have any concerns about that during the lockdown. However, 35% of our 13 to 15-year-olds and 40% of our 16 to 18-year-olds said they were very concerned about their physical health when the restrictive measures were in place. In addition, that 29% of boys and 44% of girls said they were sleeping worse than before the pandemic, and 35% of young carers were struggling to eat healthily and get enough exercise, and 14% said they struggled to acquire food and medicines. Next slide, please. Many young people were also really concerned about their educational prospects. So there was 73% were moderately extremely worried about exams and coursework, and 72% of our older children were moderately to extremely worried about education in general. And young people also found that homeschooling was really stressful, with 55% of boys and 60% of older girls finding it really hard to adapt to homeschooling. And 45% of our young carers found they didn't have enough time to study, although a substantial number also said it helped them to cope by being at home. So that was a mixed picture. Next slide, please. Also, around 6% of young people were really concerned about the impact of restrictions on mixing with friends and family. And of course, that's continued now, especially now we've moved to the levels, and for the parts of the country where people are in levels 3 and 4, and restrictions, especially they move into level 4. And 74% of young carers said they felt less connected to others since before the pandemic. Next slide, please. On mental health, we've also seen kind of a downward trend since the pandemic started. So first of all, the first set of figures here shows concern about people's own and others' well-being. So mental health, MHWB is mental health well-being. So particularly with increasing age, then young people, particularly 16 to 18-year-olds, had concern. 73% had concern for their own well-being, and 61% for others' mental well-being. Oh. We also looked at low mood. So there's this big survey called HBSC, which is done across the whole of Europe. And we looked at how many girls and boys said they had felt low mood recently in that survey, which is pre-pandemic. So 41% of girls, for example, had had a low mood pre-pandemic, and that's increased in the WHO Wellbeing Index, which has been done since the pandemic, to 59%. And you can see that for younger and older boys and girls, there's been an increase, not so much for older boys, but in the other age groups, there's been an increase in how many of our young people are feeling a low mood. Next slide, please. And finally, on mental health, there was children generally did feel negative about the closure of their place of education. I imagine that quite a few young people were quite happy at the very beginning to have a few weeks off school, but as that time continued, they felt very negatively about that and the fact that they were missing out on that. And in terms of young carers, 45% said their mental health was worse than before the pandemic. 69% of those young people feeling more stressed, and 38% feeling unable to cope. So we're seeing, I would say, we've seen, certainly seen, and I'm sure the talks that you'll hear through the rest of the day will back this up. We've seen some, some real impacts on our young people around their mental well-being. Next slide, please. I also wanted to just talk about the impact of poverty. So the impact of COVID-19 will have heightened poverty in certain groups. We know that. We know it's had an impact on low-paid workers, underemployed workers, women and ethnic minorities who are already struggling. We also know that young people across Scotland are facing some of the toughest labour market conditions. So there's been modelling done that suggests that youth unemployment has peaked, with over 100,000 young people facing unemployment by next year. That's over 1 in 3 of our Scotland's young workforce. We also have seen the biggest increase in universal credit claims. Younger claimants, our under 30s, are showing the largest increase in claims since the beginning of the year. It's almost doubled. And our younger claimants now represent just under a third of all claimants. So this just reiterates the fact that our young workers have been more likely to be impacted by employment sectors shutting down and by being on 0-hour contracts. Next slide, please. This graph shows what our children in poverty levels were before COVID. So around 24% of our children were living in what we call relative poverty before the pandemic hit, and we expect that when we get the figures for this year that will have increased. Next slide, please. So what do we do? So there's nothing inevitable about poverty. We can solve it, and the increase in poverty due to COVID isn't inevitable either. And we know, for example, that during economic downturn that we saw back in 2008 to 2012, that some countries actually managed to get a decrease in child poverty. And that was due to the social protection policies that they put in place for children and families. Next slide, please. So I feel like I've probably depressed everybody. So I wanted to finish off by just talking about what we can do. So next slide, please. So some really practical things that we can do around the poverty issue in particular. So we know what makes a real difference to incomes. We know, we know that we need a whole system approach, and that we need to all work together. And there's a real role for yourselves in this, in helping to advocate for this, in making sure that the young people that you work with understand what's available to them in terms of mitigating the poverty that they might be feeling. Next slide, please. There's also the Scottish Government's Youth Guarantee. So that's where all young people between 6 to 24 have the opportunity to go to university, college, and apprenticeship programme, training, fair employment, work experience, or participating in formal volunteering programmes. So it's how do we make sure that that collectively together we ensure that all our young people are aware of this and are taking up these offers. It feels like public health and youth work have got a really strong role together in this area. Next slide, please. Next slide, please. Oh, sorry, I'd go back one. I missed that. These are some of the areas where, specifically where we can highlight to young people and their families, what's available for them, and all the different, the different opportunities around that. And then more generally, just such important role that yourselves have around providing opportunities to young people. Next slide, please. So working with young people through the pandemic is not going away. Obviously, we're in wave 2 now. We've got the levels. We don't know what's going to happen in terms of the levels, but it's likely that at some point some areas are going to move into level 4, which will increase restrictions. We have a bit of a balancing act here. I mean, I hope I've convinced you that for young people, the wider harms from the pandemic are much greater than the direct impacts of the virus. We're not seeing a whole lot of transmission of COVID-19 between children in schools, and from adults to schools is very low as well. We're not, the impact of COVID itself is not great on young people. So it's how can we all do all we can to support our young people through the pandemic while minimising the risk of spread. You'll all be familiar with facts. It really does work. Face coverings do have an impact, avoiding big groups, the hand washing, the 2 metre distancing, and the self-isolating at the first sign of any of the 3 cardinal symptoms of cough, temperature, lack of taste or smell. So, observing those those sets of rules can really make a difference in how you work with young people. There's also guidance on youth work on the Scottish Government website, which I'm sure everyone's familiar with, that gives a lot more detail on how to engage safely in youth work. So I just want to finish by saying, youth work is just so important at the moment. You can see that from what's been happening to our young people, their mental well-being, and just really welcome working with yourselves, public health, and working with you on how to minimise the risks and how to work with young people through this difficult time. Thank you very much.